Welcome to Medicare Simplified, a podcast by Sanford Health Plan that will help you make the most of your Medicare Advantage benefits. I'm your host, Mick Gary. Today we're going to give you information that can help you decipher prescription coverage under Medicare. The truth is it can be a challenge finding the right plan because there are a lot of plans out there. And choosing the right one is best done when you're familiar with the choices. To that end, we're joined by Jack Arnett today. Jack is an inside sales manager for Sanford Health Plan and can help us navigate what can be an intimidating process. It can be particularly intimidating if you're a rookie when it comes to the world of Medicare. So let's start with the basics, Jack. Let's help the Medicare rookies today.
Thanks, Mick. Good to be here and good to see you again.
We hear a lot about Medicare Part D on TV and elsewhere. Can you tell us what it is?
Sure. Medicare Part D is the federal government's Medicare's prescription drug program that's available for all Medicare beneficiaries across the United States. Medicare sets the parameters, sets the framework, sets the rules, but these Part D plans are offered by independent insurance companies across the country.
What does Part D cover?
If a Medicare beneficiary is looking at Part D coverage, I think there's three main areas they need to consider. One is the formulary. Now, a formulary is a list of drugs that particular company covers. It's a wide range of prescription Medicare medications that are kind of categorized into tiers. And that brings me really to the next thing, is the tiers. Formularies typically will have several tiers, and that differentiates the cost that an individual would pay throughout that. Generally, Tier 1, Tier 2 are your lower cost tiers, all the way up to Tiers 4 and 5, which would be some of your high dollar prescriptions, and then obviously you're going to come with a higher copay or cost share. And then the third thing is a network. For most Medicare beneficiaries, they've been with the same pharmacies for many, many years, and you want to maintain that relationship. And so when a Medicare beneficiary is considering changing the drug plan or enrolling for the first time, they want to make sure that their pharmacy that they choose participates with that particular plan. So a network pharmacy is very important for a beneficiary to choose the right plan.
So ultimately, do I need it? Do I need Part D?
A couple reasons. I would answer that a couple ways. Number one, is it mandatory that a Medicare beneficiary enrolls into Part D? No. However, if a beneficiary refuses to enroll into a prescription drug plan and they do not have what Medicare deems as credible coverage, like through an employer or their spouse's employer, they may be assessed a penalty. And that penalty stays with that individual for life. So if someone chooses, say they enroll in Medicare at age 65 and they just would say to me, Jack, I don't even take an aspirin. I'm just going to wait a couple of years, and then something happens with their health, and now they need a prescription drug plan. They're going to pay more than the person that enrolled at age 65, because Medicare will assess, that penalty. And again, Mick, that penalty stays with that beneficiary for life.
How can you get coverage?
A couple different ways. Number one, if you're new to Medicare, whether you're just turning 65 or you continue to work and now you're, beyond 65, 68, 70, Medicare allows for an enrollment into Part D at that time. Several ways an individual can, obtain that coverage. One is, everybody can just go online, do that research themselves. But as you mentioned in your opening, it is daunting, and there are a lot of options, to choose from. But that's always an option for a Medicare beneficiary to do their own research. Obviously, working with a trusted advisor, an insurance agent that has experience in the Part D is really my recommendation, because she or he will have that requisite knowledge, know the plans that are available. Part D plans actually get approved by county. Now, some are national plans available across the country, and some are just regional plans that just may have a small network or a small geographic area that those plans are offered in. So getting with that trusted advisor, a source that you know and trust that has experience in the Medicare field, is really, kind of the best way, in my opinion, to choose the right plan.
When you're listening, make sure that the person you're talking to has a handle on the local angle on this, correct?
Absolutely. And, that's going to be very easy to determine once you're starting to have those conversations. Part D hasn't been around, forever. 2006 is when the first Part D plans, came into play. So we're not even 20 years into this. But there's been some changes, and there's been a lot of companies that have come and gone. But there's some national players and some regional players that have maintained. And so when you're talking with that trusted advisor, advisor, that insurance agent that has the knowledge and the experience, you're going to be able to determine that really quickly.
Can I change plans if I'm uncomfortable with it?
You can. Medicare allows for a couple different enrollment periods throughout the year. Mick, if a Medicare beneficiary wants to opt out of the coverage that they initially chose. The first one, if you're age 65 and you enroll into Medicare, generally the first of the month that you turn 65, Medicare actually gives you a full 12-month period to kick the tires on it. Make sure that was the plan that you want, and you are allowed to make a change during that time. All Medicare beneficiaries have what's called Medicare Advantage open enrollment period from January 1 to March 31 to make a one-time plan decision or a change as well. And then throughout the year, there are what Medicare calls special enrollment periods. Most commonly, if somebody enrolled into a plan here in Sioux Falls and mid-year they moved out of state, say they moved to Green Bay, Wisconsin, and the plan they chose in South Dakota isn't available in Wisconsin, then Medicare will obviously allow them to choose a different plan in the state that they're in. But after that, and if a Medicare beneficiary doesn't qualify for a special enrollment period, after March 31st, so April 1st to the rest of the year, they will be locked into that plan till the first of the following year.
And then, if you want to opt out, how does that go?
Well, you just don't have to renew that plan, okay? You would generally have to contact the Part D insurance plan that you are enrolled in, tell them that you want to disenroll, but you can do that. But again, that penalty would then kick in. And so very, very few people will ever opt out. If nobody does anything, I'm talking about Medicare beneficiaries, from Medicare's annual enrollment period, which is October 15th through December 7th, we always encourage individuals to at least review the drug coverage. Formularies change, deductibles, copays, cost shares change, and I'm giving kind of a little bit of a sneak peek, but there will be some significant changes to Part D coverage for 2025. So it is going to behoove every single Medicare beneficiary to review their drug coverage come this fall. And Mick, there's one other thing I wanted to add. Throughout the rest of the year, Sanford Health Plan on our website, on our Align website, will have additional information relative to Part D. We are staying on top of these changes. We will be well-versed, well-educated, and be in a great position to provide excellent information and guidance for all Medicare beneficiaries, come this fall. So I would encourage individuals, if you are kind of pre-shopping and just want some knowledge and what's going to happen this fall, stay tuned to Sanford Health Plan. Look on our website. There'll be a lot of information on there at their disposal.
If you'd like to learn more about Medicare Advantage plan options from Sanford Health Plan, visit align.sanfordhealthplan.com or find more information in our episode show notes.